From allergies to zinc deficiencies, hangry to hay fever, we provide easy-to-absorb information to improve your health. It sounds like health on Texas A&M Health Talk. Howdy, welcome to Sounds Like Health. My name is Mary Lee Meyer.
I'm your co-host, Sam Kraft.
And we are here today with Dr. Brandon Williamson. He is a clinical assistant professor at the Texas A&M College of Medicine, and he works a lot with our family medicine residency program. Thanks for coming on the show.
Thanks for having me, guys. Really appreciate it.
Yeah, so it is Men's Health Awareness Month. And so we brought you here today to talk a little bit about some hot topics, some important things men should generally know about their health.
It's like the stuff that men don't want to talk about, but they need to talk about it because it's health related. like some of those come out today, I bet.
Sure. I think what I think a lot when I think of men coming to the doctor's office is usually their wife or significant other dragging them, which we like to make fun of, right? But also, I think a lot of times men just don't want to be a burden. They're used to being,
for sure.
They're used to being going to work, not complaining, all that stuff. So it can be hard whenever you are sick or do need to be taken care of. But there are definitely things men need to think about in their life. You know, I think something we see people a lot for in the hospital is just heart disease, right? People that come in either worried about heart disease or have a heart attack in the hospital. And I think we've been done a great job about raising awareness for women in that situation, that, man, they don't have the typical symptoms sometimes and they really need to keep track of what's going on. But, you know, men, they end up with all the risk factors, it feels like. It hits them younger, higher blood pressure, high cholesterol. You know, all of our jobs are behind a desk now. And then family history. I bet just in this room, we probably have family history of cardiac disease. Yep, you got it.
Yep, grandfather.
And so it is just something you need to think about. And this is, I don't want to get too into the weeds, but really they've expanded the guidelines for who needs to have be on medications to lower cholesterol and things like that.
What are the stats on men and heart disease? Is it the number one killer of men?
I believe so. Really, I think about just all the things that go together. We end up with diabetes and the high blood pressure and all that stuff, just wrapping up into a perfect storm of
heart problems
disease.
Seem to be kind of overlapping into a bunch of other problems.
And they're all married together, too.
Yeah.
Yes, they all travel together, unfortunately.
Obesity and then diabetes and then high blood pressure, cholesterol. It just dominoes downhill, it feels like.
Yeah, exactly.
What does high cholesterol do? Why is it bad? Because I know we need, it shouldn't be high, and I know there's good cholesterol and there's bad cholesterol.
I've had good cholesterol be bad, and that was confusing. I had too much of it or something. That was confusing.
It's all just beyond me.
Yeah, sure. So, you know, you can't avoid eating fats and cholesterol. Well, maybe if you're very strict, but I think for the vast majority of us, you can't avoid it. So your body has to figure out a way to move it where it needs to go, to the liver, to make other things. Well, in the process of moving it, it has to go around the blood vessels. And depending upon the kind of cholesterol you have, which is a big area of research right now, it may be predisposed to getting put into the vessel walls. You know, your arteries around your heart, or really any place in your body, your brain, for instance. And so how can we prevent it from going there and being in the place we want it to be, which is helping your body sustain itself? So that's where, for instance, everyone, I think, has heard of statins recently. And those are probably the biggest advancement in preventing heart attacks in the last 20 years.
Wow. Well, that's a good point. The technology of healthcare as far as treating heart disease seems like it's come a very long way.
Yeah, for sure.
I mean, and even in the last 10 years, it's just multiplied so much because it's become such a big problem. I guess it's become more of a focus.
Yeah, and I think if we can keep people from having that heart attack, being in the hospital or having other complications from it, man, that is ideal. That's where you need to go see your primary doc for, is to talk about that. I tell guys, I have a lot of friends that ask questions, and I tell them, you know, if you're pretty healthy, you can probably get away with things until you're in 35 or 40 range, but you really ought to go at least establish a relationship with someone and just talk with them about how you're doing.
That's a good point, that age is, I mean, it gets everybody, but I think it's, for what you do, in men's health, when should a man be really concerned about? They should always be concerned about their health, but we really need to get established with a system. Going to see a doctor every 6 months or whatever
and
it is.
especially because things like high cholesterol, you don't know. Like if you don't go to the doctor, you know, or the
they just sneak up on you.
Yeah,
I mean,
and you just don't know
know
until you come down with.
That's too late.
Yeah. So nowadays we're screening kids even for cholesterol problems. And so if you have something that's really bad, it typically is picked up when you're a kid. But really, once you're a young adult, you're in your early 20s, you need to have at least one visit where you can see somebody and establish, and then find someone you trust, and then they'll kind of guide you as to how often. So yearly, if you're healthy, is pretty common. But if you, and I'm talking to everyone who's listening, but if you are 35 or 40 and you haven't been to a doctor, you need to go. So make that appointment. It may be that he just says, hey, I'll see you in a year or two, but just go.
Yeah, and go get some blood work done, make sure everything's okay, and yeah.
And this might be a silly question, but what is the difference between, you know, having heart disease and then having a heart attack? Do you have to, if you have heart disease, is that just the chronic state of possibly having a heart attack? Like what is?
Sure, exactly.
I've never known.
Yeah. So when we've done, when they've looked, you actually develop cholesterol deposits in your arteries when you're pretty young, like late adolescence. But as they build up over time, they form what we call plaques, and if those are unstable, they can break apart and then block the vessels around the heart, which lead to a heart attack. So if you do have heart disease or you have atherosclerosis, the fancy word for it, it predisposes you to have a heart attack, which is what we're trying to prevent.
So with congestive heart failure, I know that's like I always thought that was just, you know, he died of congestive heart failure. Like it was a one-time event, but knowing what I know now, my father-in-law has congestive heart failure. That's a long-term disease. Is that considered heart disease? Does that fall under that category of things, or is that its own? It's
definitely a form of heart disease. A lot of heart failure is caused by cholesterol issues, and maybe you've had small heart attacks in the past, but also the other things, high blood pressure. It's hard for a heart to squeeze against a really high blood pressure. Diabetes, all those things can affect your heart and lead it to have heart failure, which is really just not squeezing the way it should.
And so are there any specific symptoms men notice that they might not know?
Yeah, so we have to go over, like, men are just predictable. Most of the time we have the usual symptoms. So
it's like your left arm hurts.
Exactly.
It goes numb. Like those are the ones that's the one I know of.
Yeah.
And what are I'm interested to know what the other ones are. I don't
so
know.
when I talk to my residents, they tell me, and I'm like, well, is it chest pain or pressure? Does it move into an arm or up to a neck? Are they sweaty or nauseous with it? Does it get worse if they go for a walk or run? Does it get better when they rest? Those are all really concerning signs.
So left arm numbness, sweating, somebody stepping on your chest.
Yep.
Is there an order to those, or is it just kind of random, but they all tie in together?
Yeah. Your heart does what it wants.
Oh.
So, yeah. But, you know, like a third of people...
That was oddly romantic.
I know. See, I'm referencing the Valentine's video. You got it. Okay. But yeah, about a third of people don't have chest pain when they show up.
Really?
And so you can just have shortness of breath, fatigue, the nausea that we talked about. Some people have some palpitations where they just feel like their heart flip-flopping in their chest. And so if you're feeling those, and, you know, I get tired, right? So everyone gets fatigued. But if you're really feeling bad, you need to let somebody know. Either calling
something like more out of the normal.
Exactly.
Yeah, I know somebody who's very, very healthy. He ran half marathons every other month, it felt like, and he had a heart attack. So can healthy people have them too?
Of course, we can't get a picture of the inside of your arteries, unfortunately. We know now that part of like having a heart attack is that there's some form of inflammation, and that's part of the reason why we think statins help, is they don't just decrease your bad cholesterol, but they decrease the inflammation. And so even if you are perfectly healthy, the heart does what it wants.
That's so scary to think. I mean, you know, you get out and, you know, you're a runner and you train every day and I'll run 10 miles a day, and then you have a heart attack. It's like, what happened? I thought I was doing everything I could to prevent this. Oh, it's terrifying.
And what in the world is a small heart attack?
It's a little baby heart attack.
Yeah. I think they're such a big, significant event. So putting the descriptor small in front of it,
Yeah.
is strange to me.
So there's two big arteries that go to the heart. Okay, left and right, very simply named. But then as you go farther down, they get smaller and smaller. And so if instead of one of those big arteries getting blocked, if you have a smaller one blocked, that's all that means is a small heart attack.
Oh, so it's not necessarily the severity of.
Well, a
the
big
heart
one is
attack?
certainly more severe,
Oh, that's
right?
true.
So a classic kind in men is called a widowmaker, and that's where a specific artery gets occluded. It's because a lot of folks with those don't survive to make it to the hospital.
That's terrifying. In addition to heart attacks, I think another big major killer, so to speak, in men, and I mean everybody, would be cancer. And prostate cancer is a real thing, and it's really, really treatable. I think in the first few stages if they catch it early enough. Is that correct?
So prostate cancer is one of the biggest areas of debate right now. So if you talk to like your parents, for instance, your dad probably had his PSA, prostate specific antigen, checked every year for a long time. And so we were doing this for a while where we would check everyone, and then you have to go and you have to get a biopsy to see if everything's okay. And then if you find cancer, you have a big surgery.
Every year was a biopsy?
No.
Oh, good
no,
Lord.
if your level was elevated.
Okay.
Yeah.
Thank goodness.
Yeah. Oh my god. Yeah. No one would get screened if it involved a biopsy every time. Yeah. You're gonna do what? No.
No.
Nope. I'll
Next.
pass.
Yep.
So you would get a blood test every year, and then if it was high, you would get a biopsy, and then if you had cancer, you'd have surgery or radiation. And then we found out that the surgery has some bad effects, and even the biopsy does. Like the biopsy is, they take pieces of the prostate, and you have between a 1% and 4% chance of having to go to the hospital for an infection. And then the big two complications men care about after having your prostate out is 1, sexual dysfunction, and 2 is incontinence. So you end up urinating on yourself and having to wear diapers for a long time, or pads. And that's a big deal. So not too long ago, and if you just survey guidelines in North America, a lot of them are saying you really need to have this discussion with men before you order a test, because what we found is that a lot of men don't die of prostate cancer, but they die with prostate cancer, meaning your heart disease, for instance, is much more likely to take you than prostate cancer. Prostate cancer we're diagnosing all the time. It's just you need to know when to screen for it. Okay. Because a lot of people will have it and it will just stay at a low grade for the rest of their life, and then something much more benign will take their life.
Are there any symptoms to it?
So unfortunately, there aren't any great specific symptoms, meaning that's what it is. Just think about what a large prostate does to men.
Can you remind me what a prostate does?
Yeah, I'm getting there. And so all the older men will know. But
you have to pee a lot.
Yeah. So you urinate a lot at night. You sometimes feel like you haven't finished peeing because you're being obstructed. It's obstructing your urethra. You're having to go more often than usual. You have a weaker stream, things like that. So those are they're called lower urinary tract symptoms.
Well, and for a guy, especially in that department, when something's wrong. Like when you're not.
It's a true statement.
Well, when you're not yourself. It's like you talk about like low stream is a good example. It's like when you get there and you're just like, this is just not normal me.
Yeah, and it's amazing what guys will deal with. So if it's not prostate cancer that causes a large prostate, vastly more common is just BPH, benign prostate hyperplasia, where your prostate gets big, and that's just part of becoming older man. And if you talk with older gentlemen, they'll go pee 3 or 4 times at night, and it's just their life, and they deal with it. So
I can't imagine that many times.
Yeah.
It kind of sounds like a UTI.
Yeah, except for they shouldn't have any burning when they pee.
Fair enough.
Yeah, men can get urinary tract infections, but. So then, who to screen, I guess, is the question. If someone's listening, they're like, should I get screened? Well,
yeah, I mean, is it like 40 and on? I mean, I'm 38, and I think I started getting prostate exams when I was 34, 35.
Yeah, so are you, maybe HIPAA violation, but are you a high-risk patient is the question.
I don't believe so. What are the qualifications?
Yeah, so I think high risk mostly is if you've had at least one relative that's had prostate cancer. And then some organizations say more than one. And then the other one is African American race is you have a higher risk for whatever reason.
I think my doctor's just being overcautious, which I'm perfectly fine with.
Yeah. And that's a big thing is you just have to have a discussion with the patient. So most people are not recommending screening less than 50 or 55 years old unless you're a high risk patient. And then the talking with the patient before you screen in that 55 to 69 age range. So you need to know if something comes back positive, are you willing to deal with the downstream effects?
Those crazy side effects of what you said, that the biopsy and all that. I'd never heard that before.
Yeah.
Oh, I was going to ask, how far does that family history reach? My grandfather had prostate cancer. So does that mean that my brother should be more aware of it? Or if I ever have a son, how far does that family line travel, I guess?
In general, unless we're talking about genetic syndromes, they mean the first degree relative. So your father, your mother, your siblings, your kids, those are all your first degree relatives. So if your great grandfather had something, then you're probably okay.
And so what about testicular cancer? Because that's another man-specific cancer.
So testicular cancer is about 1% of men's cancers. But what is really good about it is probably one of the most curable forms. And if that's the case, then no one has recommended screening in an average risk patient. So if you're very paranoid, you can do, just like women do breast self-exams, you can do a testicular self-exam once a month. But really they usually just recommend those in patients that are high risk. So those are folks that have had an undescended testicle when they were kids. If they've already had testicular cancer once, you don't want to miss it again. And then if you have a family history like we talked about. Yeah.
And does any treatment for that impact any male hormones or any
They usually
create any
just
sexual
remove the testicle, don't they?
or-
Is that a normal procedure?
Yep. Usually you take out the testicle and make sure it hasn't spread anywhere else, and most men do very well afterwards. Very well. You have a backup in place. So. Yeah.
I got another guy. It's okay. So what other? I mean, I guess cancer is cancer and heart attacks. Those are the big scary things. Yeah. What about the lesser things? I say lesser just because they're not as scary as heart attacks or
They're
cancer.
not life-threatening.
Yeah, I mean, like low testosterone is a thing I think a lot of men deal with, especially in older age. What age do you start to lose testosterone?
Yeah, so that's an area of debate. So probably your testosterone goes down, especially after you're 60 years old, especially as you get older, even after that. But the question is that normal or is that abnormal, right? Because if it's normal, then maybe we shouldn't be trying to do anything about it. And I don't know if you guys, I haven't seen any around Bryan College Station, but I was in Dallas-Fort Worth before moving here, and there were low T shops all over the place.
Really?
And so that's what the clinics are for, is you come in, you get your tests, and I bet a large percentage of men ended up with testosterone replacement therapy after.
What I guess for the people who don't know what testosterone controls, can you explain a little bit about what testosterone actually does for men?
Yeah, so the main thing is it like libido, of course, but then muscle mass, and you just think about all the things that distinguish a man from a woman. You have a lower voice, you have, again, more muscle, you have a distant distribution of body hair, like your beard, for instance. Testosterone. Yeah.
And I think low testosterone, I would assume, probably plays into probably some mental health issues as well. If you're losing your voice, so to speak, from a male perspective, or there's other areas where that plays into. I think that could really get you into depression and could just multiply into other things.
And I bet like a lack of libido or trouble in that area can cause a lot of anxiety or stress.
And stress on your marriage and stress on you, anxiety, depression. I mean, I think all that falls into that category of things.
Yeah. I think because these low T shops are around, I think people are really trying to cut down on inappropriately prescribed testosterone. And so if you just think about, like, when I was younger, I just could do a lot more and I wouldn't get tired, wouldn't get sore, all this stuff. And even now, like I pick up my kids the wrong way and I'm paying for it.
Oh yeah, no, like you just you sneeze the wrong way and you're done.
Yep. How did this happen?
Yeah.
How is this happening?
I understand.
But a lot of things are just getting older.
Yeah.
You are not going to have the same energy as a 70-year-old man that you did when you were 18 and playing 3 sports, doing 2-a-days, all that stuff. Nor are you going to have the same muscle mass as when you were younger. And so one is telling people, do we have realistic expectations here? Schwarzenegger and oh my goodness.
Sylvester Stallone?
Thank you so much.
Yeah.
Stallone,
those are the two, because they're in their 70s now and they still look like they're in their 40s or 30s even.
And I don't think that's quite the natural course.
I'm sure that it's not
Mr.
the natural course.
Stallone. So anyways, but some of those things, like a very specific sign of low testosterone is if you lose the body hair that you had before, the decreased libido we talked about, and partially that's like decreased morning erections. That's a sign that you have a normal testosterone. If you have a low bone mineral density, and then if you have a concerning history, like maybe you've had radiation of your brain for a cancer before, or you've had a bad trauma, or you've had testicular cancer, things like that. Those are all reasons why you probably ought to be, if you have those symptoms, you should be screened for low testosterone. But we're really cracking down on this. Is it fatigue, depression, or just you're not as strong, or you have more body fat than before? Those aren't necessarily due to testosterone, nor will testosterone necessarily fix all those things. And so if you have a concern, don't go to a low T shop, but go
see a doctor.
Yeah, go chat with your doctor, because there are things that affect all of that. Those are very non-specific symptoms. You could be depressed not because of low testosterone, but because, man, you have like some hard things in your life you're going through and you need to get through and need to talk to someone about. You could be tired all the time because you have 4 kids and you are just in the thick of it for the next 10 years, and it's going to be that way. You could have other issues too, other medical problems that are causing this that isn't necessarily low testosterone. So I would just caution people to not look, and it's what we look for. We want a fix that's like something that's missing we want to fix, but things like, have you done the basics? Are you eating better? Are you sleeping enough? We have 1,000 reasons to not sleep at night, guys. And it's not just kids waking up in the middle of the night.
I always see those sketchy commercials late night about the different supplements and the different probably not
pills.
FDA regulated
exactly
type of stuff.
Man, you already caught on to it. So they can
I
put
think
whatever they
everybody
want in
sees
there.
those things. Well, that's what's so terrifying is that when people think that, I've got low T, just for example, and it's like, well, I'll go to the tea shop or whatever and just buy some, and it's like, you don't know what's in there. I mean, I think it's like a crapshoot. Yeah. Lord knows what you're going to be putting in your body.
For the supplements, you have to be careful, and that's the reason why we're supposed to ask everyone what supplements are you on as well, because some can interact with your medications. The statins we talked about before, there are other drugs that can interact with those, and other supplements that can interact with them. But if you go into a low T shop and they prescribe you testosterone.
Wait, they actually prescribe you?
Yes, it's a prescription.
Okay.
So an injection or a foam or whatever.
Is this a medical professional doing this?
Yeah,
okay.
Yeah. And so
I just never heard of these shops before.
So hopefully,
like a licensed professional.
Yeah, it's a prescription.
I'm so confused. I just never heard of these shops before.
Yeah, well, go on your road trip to Houston. This weekend. Go look around, see if you can find some. But
I feel like it's a pill factory waiting to happen.
Yeah, I think so. Unfortunately, and there are risks to testosterone too. We don't have great studies, but things like your prostate can get bigger, which we talked about earlier.
Okay.
All right. You can sleep apnea can either start or get worse. Your cholesterol probably get a little bit worse, and then probably the biggest controversy is, are we increasing your cardiovascular risk?
Oh yeah.
And so some studies say, oh no, but some studies say it does get worse. But I haven't heard of a study that says it gets better. So I would just strongly consider not replacing it unless you really meet criteria for low testosterone.
I think everything we've spoken about today just sounded like just a bunch of random symptoms that could be something. I think that sounds terrifying.
I think that's what life is, though. I feel like it's, if you have one thing happen to you and it's like, oh, this is what it is. No, it's really like 6,000 other things that are happening to you.
Yeah.
That are just like this one other big thing.
And I guess that's the role of your primary care or your family medicine doc. That's your resource. If something doesn't seem right, or if something, you just have that little question pop into your head. I guess that's what you're here for.
Definitely. I think one of the things there are a lot of things people come to the doctor for, and we don't have a diagnosis. And that's frustrating for everyone involved. I just want you to know it's frustrating for the doctor too when they're like, I don't know what's going on. But I tell my residents that one of the most important things they can say to a patient is that I don't know what's going on, but I'm not concerned. And part of your training and seeing patients for so long is seeing the concerning things and knowing what does need to be worked up, when labs need to be ordered, or x-rays, or even just to follow up to talk with someone again. And so if you're concerned, by all means, make an appointment. Spending 15 or 20, 30 minutes with a doctor once a year isn't a bad way to spend your time.
No, and I think as a male myself, and knowing, having those lower body problems, it's embarrassing to talk to people about it. But if there's one person you can, it's your doctor, and you should make a point to do it, because if that one thing is bothering you, if it spirals into something else, which sounds like it easily could, it's going to be a lot worse in the long run.
And it's even better that way. You just stop thinking about it. Like if you're worried something's an issue, at least with me, I'll always think that it's an issue until I hear otherwise. So even just like for sanity purposes.
Well, just stress and anxiety. I mean, there's two things right there that just grow and cartwheel on themselves.
Yeah, and I think things that people get embarrassed about are things that a doctor hears every day, multiple times. Sure. And so you're never going to surprise a doctor. It's never going to, it really isn't. And so even if you're uncomfortable, the doctor's probably heard what you're going to say many, many times over.
Probably 2 times before he saw you that day, or he or she saw you that day.
It would not be surprising at all. Yeah, for sure.
Yeah, so we know the importance of spending, a little bit of time with your doctor every year.
See your doctor.
Yep. And I'm glad our listeners have spent a little bit of time with us today. Brandon, thank you so much for coming on the show. I think everyone learned. I learned a lot.
Yeah, no, I did too. I mean,
hopefully,
cool.
Everyone
thanks for
listening
having me,
did.
Yeah, thanks for coming.
Yeah, I really appreciate it. It's been fun.
Yeah. So thank you everybody for listening. This has been another episode of Sounds Like Health.
Thank you for joining us on Texas A&M Health Talk, a production of the Texas A&M University Health Science Center. Visit us on the web at vitalrecord.tamhsc.edu, where you'll find answers to all of your health questions. Until next time, stay healthy.